So today is the 27th of May 2026, and after a long battle or just a really confusing time with my mental health, I have officially now been diagnosed on the NHS with autism and ADHD. And I've told a couple of people already, most people in my life, and they are asking, how do you feel? And the truth is I don't really feel anything. I'm kind of indifferent at the moment, and I think it will probably take a while to process something like this. I'm not sure. Um, but even when my psychiatrist gave me the diagnosis, I still had the doubt to say I'm not 100% convinced that this is ADHD or this is autism. Not because I don't want it to be or I'm ashamed of it or anything like that. But I guess for me, I forgot what I was saying. I don't know. So, a long story short, I have been struggling with dysthymia, depression, anxiety, things like that for a long, long time. And only recently, past couple of years, it's been really treatment resistant. Like nothing's been able to really pull me out of certain symptoms of depression. And that's led me down a path of trying to find answers, trying to figure out why I'm always lost or always confused or always feel maybe misunderstood sometimes. And I feel like the older I've become, the harder life has become also. Just trying to juggle everything, and even still, I cannot juggle the way some other people juggle. And I then thought by returning to education and seeking out a purpose that would make things better and I would be on a good path, find a purpose, and my depression would lift and everything would get much better. But the opposite happened and I burnt out, crashed. I was already fighting kind of this grief, this delayed kind of prolonged grief that I had with the death of a family member, and then I had a huge panic attack years later that I was struggling with DPDR and anhedonic symptoms. And then now it feels like after the kind of burnout crash, I was seeing a private psychiatrist for a few months and then managed to get a psychiatrist on the NHS. Thankfully, it kind of worked out at the correct time, and I've tried 7, 8, 9 medications for depression, and I still don't feel like me. Like, I still don't feel. I don't know if I will ever have that back. The old me, the me that was there before my mum passed, the me that was there before the anhedonia. I don't know if that exists. Hopefully, it does. Hopefully, this is the kind of missing piece of a very long-winded and struggling puzzle. But I left today feeling like okay, maybe there's hope with my life, because only a few months ago I was pretty. I just didn't really want to be here, to be honest. And although I know better, and although people, yeah, you have people that care about you and love you and stuff. I just feel like sometimes the brain just feels like it snaps, and yeah, I don't know if there's going back. I don't think there is. So with this diagnosis of ADHD and autism at the age of 30, I'm almost 31. My answer is, to people that ask, how do you feel? I don't know. I thought I would be relieved, and then I thought I would be angry, and I thought I didn't know what to think really, but I don't know what I'm feeling, to be honest. I feel like it's just a big kind of perspective change. And the good thing is, maybe I can look back on things and give myself some grace about things that I'm not too proud of, or things that I was to really pushing for in life. And I've said to the doctor today, I was like, doesn't matter what I do in life, I'm always up against resistance. Like, it doesn't matter like what route I take in life, I always meet resistance. It feels like the path that I take in life is always the wrong choice. It's always the wrong time. It's always the wrong. I don't know. I just feel like I always pick the wrong decisions based on my nervous system. I always seem to regret. I always seem to regret things like, why did I do that? Why did I do that to my body? My body's not strong enough to handle that. And then my brain is so understimulated sometimes that I'm just so bored and anhedonic and just like, oh, this world is so boring. And I just miss the way it used to feel. And maybe I've always been different, but now it's kind of somewhat medically confirmed that you're neurodivergent, and that's why you perceive the world a certain way, and you may perceive people a certain way, and you may perceive life a certain way. And one of the kind of fears that I have, especially since this last kind of like severe depression episode that happened in the winter there, from all the burnout and all the stress, is I asked the doctor. Well, I think the doctor was asking how I was feeling about things, and I said, I'm not sure, but the thing that worries me about being neurodivergent is the statistics. the statistics about suicidality, the job market. I think I read somewhere that only a third of people with autism successfully work. Um, there's a lot of other things about people with neurodivergence getting perceived a certain way. They're usually targeted a certain way in society. And the messed up thing about it that my brain cannot process and hasn't been able to process for months now is, why is this a disorder? Why is it wrong to want things a specific way, or to have a stringent moral code, or to just want life to be safe and predictable for some people? Or even if you're ADHD, why is it frowned upon to want to change jobs every now and then? Why is it frowned upon to want to have fun? Why is it like, I just feel this whole video in itself is ADHD, but I don't know. I hope that this is the beginning of the curve for me finally getting out of this long kind of slump of, I don't even know what you could call it, to be honest. It's quite um, it's been quite complex. Just the thought of having depression, anxiety, and then neurodiversity on top of that, so ADHD and autism. And then you add other kind of factors, like sexuality and kind of other environmental factors, and you're thinking. I think to myself, I don't stand a chance in terms of my mental health. I think, right, okay, what are the chances of me successfully making it to 50 or successfully making it to 6? I don't know, because I've been so tired, very, very tired recently. And I've only just learned that I'm neurodivergent, but even though I've just been told I'm neurodivergent, I don't want to slow down either. And that's really frustrating to me. So the nurse that I speak to, the mental health nurse, she's very keen on me being patient and taking my time and trying to kind of slowly but surely come out of this long rut. And I'm very impatient. And I just feel like I'm waiting and waiting and waiting. And the longer I feel I'll leave it, the more pointless all this becomes. For the past while now, my body's been saying that I can't keep up anymore. It can't keep doing normal things that I used to be able to do. And I'm fatigued all the time and I'm overwhelmed very easily. And I'm just hoping that the medication that the psychiatrist is going to prescribe will make a big difference, because I feel like this is one of my final attempts at trying to have some sort of a normal life. I've been trying for years to really think my way through life and try and pick a career and try and pick, a life path. And like I've said earlier, it just doesn't seem to work. And I've never understood why. I just thought it was the economy or my sexuality or my personality or I was just assumed it was just me being weird or being difficult. And I don't know much about autism or ADHD as of yet, but the kind of general consensus is that my body is constantly overwhelmed, and it has been for a very, very long time. But I don't know how to fix that. I don't know how to. I don't know how to live a life without all the mistakes that I've made and the kind of regrets that I think about and the kind of times in my life where I feel like I could have changed things. And I guess that's something that I'm going to have to come up against as I am almost 31 years old. And if I would have known that I was neurodivergent, maybe I would have made different choices. Maybe I wouldn't have thrown myself in the deep end so many times because I was comparing myself to people that weren't like me. And I thought that I just had to try harder. And by trying harder, I've effectively made myself exhausted and made myself burnt out. And couple that with a few traumatic incidents, and I have been rendered pretty much low functionality since winter, and it's been slowly building up, which is good. But I just never knew that ADHD burnout or autistic burnout, whatever you want to call it, could make someone feel so mentally and physically and emotionally sick, like sick to their stomach. Yeah, I'm waffling, so I'm gonna cut this. But I just thought I would make a short video, kind of talking about my thoughts and feelings about being diagnosed today, because I don't really know how I feel, and hopefully it's for the best. That's what I'm kind of hoping for. I'm hoping that this helps me rather than hinders me.